We're going to talk about the digestive system, its common diseases, treatments, and how to prevent them.
The most common diseases are diarrhea, malabsorption, weight loss, abdominal pain, food intolerance, ulcers, gastritis, esophagitis, colitis, appendicitis, and reflux.
The most common way the digestive system gets damaged, parasites can damage some parts of the digestive system. Things you can consume which could damage the system would be any chemical acids, bases like HCl or bleach. Toxins can damage the whole body, including the digestive system. Alcohol damages the tissue of the stomach and esophagus. Disorders can have serious effects on the system: anorexia, hypothyroidism, gastroparesis, etc.
The main cause for infections are because of the acids, the alkalis, if the person had a previous damage that had been born with a disease, the drugs, and the cigarette.
Diarrhea describes bowel movement stools. They are loose and watery. It is very common and usually not serious. Many people will have diarrhea once or twice each year. It typically lasts 2 to 3 days and can be treated with over-counter medicines. The common diarrheas are osmotic, secretory, and exudative. The causes of these are infection by bacteria, eating foods that upset the digestive system, allergies to food, medications, etc.
Gastritis is inflammation of the lining of the stomach. Unfortunately, the term gastritis has been misused to include many different upper abdominal problems, but true gastritis refers to the stomach lining that is inflamed. All or parts of the gastritis mucosa may be involved. Gastritis may be classified as acute or chronic. Some causes are bacterial, viral, certain drugs, alcohol, and reflux.
Peptic ulcer is an area of damage to the inner lining of the stomach, esophagus, or duodenum, the first part of the small intestine. People of all ages can suffer from ulcers. Men and women are equally affected. Peptic ulcers are formerly thought to be caused by stress, coffee consumption, or spicy foods, also by bacterial infections.
Colitis is inflammation of the inner lining of the colon. It may cause abdominal pain and diarrhea with or without blood. Fever may be present. There are numerous causes of colitis, including infection, inflammatory bowel disease, ischemic, and microscopic colitis.
Some diseases can be contagious virally. For example, if the food is prepared with too much time, or when it is then refrigerated, or when it is covered up and it is in outdoors, it can be contaminated by virus or bacteria. When the food from outside in the stores, there is too many people and they are sick, the food gets contaminated, and you can have a disease too. If the person who is preparing the food don't use gloves, don't disinfect the food, doesn't wash his or her hands, or don't cover their mouth, the food can be also contaminated, and it can affect people's digestive system by consuming the food, and they can get severe diseases.
Some suggestions for having a better digestive system flow are to eat fruit and vegetables, eat always at the same time. Then you have a disease any kind, don't eat bread, soda, chocolate, sugars, cheese, and milk. Make exercise daily, at least 30 minutes. Don't ingest chili. Eat 5 times a day, breakfast, snack, lunch, afternoon snack, and dinner. And do not drink alcohol in excess.
Also, there is nothing better than going to see a doctor so he can tell you what to do, what antibiotics take for the disease, and how to treat the disease.
Many infections are because of parasites, bacteria, excess of alcohol, and smoking. The most recommended ways to prevent an infection from happening are these. You should eat at home, not outside where the foods aren't disinfected. They may be contaminated by parasites, bacteria, and then it may cause you to throw up, nausea, and diarrhea. You should also eat in hygienic places. Look if people who prepare the food washes their hands, disinfect the food, and work clean.